Good morning, Namaskar. On this day, January 20, 2021, this is Suraj saying back to you regarding COVID-19 talk. Some information, additional information regarding vaccination too available. So, little change in format, but information is same. And talk is Bharat, India, and analytical informative talk on COVID-19 plus variant strain status for January 19, 2021, reported on January 20, 2021, that is today, Wednesday. Government provided data-based worked out spreadsheet file to screen share for national awareness for whatever is happening. We know that sometimes something unusually happens. As you can see these graphs on sheet, two graphs, one is for daily cases and daily positive cases and daily tests conducted, and also vaccinations regime, which is here. Before going further, I would say that till now 6,74,835 persons have been vaccinated, apologize for wrong word, have been inoculated. इम्यूनिटी ग्रांटिंग वैक्सीनेशन अब तक 6,74,835 लोगों को इंजेक्शन लगाया गया जिससे इम्यूनिटी बढ़े उनकी, और ये हमारी देश की जनसंख्या का 0.052% है। अभी हम इस बारे में कुछ नहीं कहना चाहेंगे क्योंकि स्टार्ट हुआ है, जरूरत से आशा से कम स्टार्ट हुआ है, लेकिन वो है, बढ़ेगा नहीं बढ़ेगा देखते हैं। हमारे जो व्हाट आई एक्सपेक्ट इज दैट इट शुड बी 1.424 करोड़ एवरी डे, but till now in 3 days, I think 3 or 4 days, it has gone to 674. This is today's update, and this is 0.052% only. This is just I'm giving you something new. And also testing has gone down, and this is 48% down than end of year, which is also shameful, you can say. Or before going further, I would like to add here that what is account of yesterday. Let us see in first week of this. This is account of yesterday, and this is a format, I can say. This is government given data here. This is government given data, and others we have worked out. Projections, these projections we have worked out. These graphs we have included here, and what is government saying is this much, and we are saying this much. All right. And here is requirement or controls, and here you can say same thing is here. Non-chargeable infections and non-chargeable vaccinations have been affected till now is this much. This is, I can write date if it's required here, there's no harm to that. So this date is now, you can say today is 20, so this is 20 status, I can say like that, so that it is must be understood clearly. This is today's status, and we can also put here something else like this. Okay. Point is not this how many have been injected or not. Point is this plan of that. Till now there is no plan, and here yesterday's tally is total cases. Maharashtra 19.95 lakhs, Karnataka 9.33 lakhs, Andhra Pradesh 8.86 lakhs, Kerala 8.57 lakhs, Tamil Nadu 8.32 lakhs, Delhi 6.33 lakhs, Uttar Pradesh 5.97 lakhs, West Bengal 5.66 lakhs, Odisha 3.34 lakhs, Rajasthan 3.16 lakhs, Chhattisgarh 2.94 lakhs, Telangana 2.9392 lakhs, Haryana 2.67 lakhs, Bihar 2.58 lakhs, Gujarat 2.57 lakhs, Madhya Pradesh 2.52 lakhs, Assam 2.17 lakhs, Punjab 1.71 lakhs, Jammu Kashmir 1.24 lakhs, Jharkhand 1.18 lakhs, Uttarakhand 95,000, Himachal Pradesh 5,700, Goa 52,600, Pondicherry 3,800, Tripura 333, Manipur 2,890, Chandigarh 2,059, Arunachal Pradesh 168, Meghalaya 137, Nagaland 120, Ladakh 96, Sikkim 605, Adnawar Nepal 49, Mizoram 43, Delhi, Dadra and Haveli 33, and Lakshadweep 2. It is half. We can say, well, this is 2, or there's no comma in this, so I can assume that what I'm saying is right, but actually it is 21, actually not 2. It's written 21 here, so there is correction error, you can say, no problem. Let us assume. Sometimes they don't write correctly. Now, this is our main point where we have taken average of. Average of here we have taken, and this is, you can say, 4.08 is percentage of number of active cases, 94.71 is percentage of those been discharged, and 1.21% is those who have lost their lives. And we can say this total is 100, it should be. We can verify also, let's verify here at some. We can verify, not big deal. So this is 100, so we can say this is verified. It's okay, fine. We can now no question of assumption because this is that one, or we can say, all right, we put some color here so that we understand what is this and what is this. We tally like this. So now these cases and these cases, if you sum up active cases and deaths, which means are really worrisome, and this 94.1 which are requiring or shall require post-discharge care, these are important ones. And you can say 5.29% is total of this. 5.29 GD 40 here, this one and this one. So 5.29%, 5.29% are actually effects. And that is the reason that we have taken one graph of all this data. That is here, you can say, this is the graph, this is its coverage is this. This graph's coverage here. And you can see 4 or 5 curves here. These are months and these are crores. You can say here, and we can say that this is population line, 130 crores, and here is that we can say actually these are months, means numbers of months have given, not exact one. So 1, 2, 3, 4, 5, 6, 7, 8, 9. So values are not here, numbers are coming, no problem, it's okay. And these curves are telling something, and this data is here. This is the number of crores of deaths and active cases. And that is here. That is here, this color, active cases, and this crores in that. This is here. This is what is given here. Very worrisome. While government gives clearance to everything, we are okay, we are fine, we have control everything. It's a fun, I think. And they think we have advice. We issued all advisories from government, and people have cooperated, and we have done this and that, means self-beating, self-bushing, self-praising, that's what they are doing. But something else is there, which will say, we are ready for this. Public says that. I say, people, you are responsible for everything. Don't depend on what they are saying, and they are not doing anything for you, so you have to worry about yourself. Now, this is very important text here, which is what number of people, 6,74,835 till 19 January. This is there. And this is 0.052% only of whole population. Of course, these people have not been charged because they are on medical front, but now common people have not been started yet. Once they start, we'll know how it develops, so that shall be different percentages. So this percentage of total population. So that shall also be of total population. We will see what to do with that. अभी हम नहीं कह सकते क्या हाल होगा क्या नहीं होगा, बहुत जल्दी है, हम क्रिटिसाइज नहीं कर सकते, स्टार्ट किया है, लेकिन रिकॉर्ड कह रहे हैं कि अब तक 6,74,835 लोगों का टीका लगाया जा चुका है, जो हमारी देश की 130 करोड़ पब्लिक का 0.052% है, और ये बात नोट करनी चाहिए. Now we go to sheet 1. This is number of positive cases every day, and this is test conducted every day. Still, here I have written for vaccination. This is also vaccination area. So same thing which is given there is given here, that we require this much. Nation requires 1,43 lakh vaccinations daily, while so far we have done only this in 3 days or 4 days, I think from 13th or 30th it was, so today. So whatever it is, we have done only this. 6, 7, 4, 8, 3, 5, you can say, and how many days? 13 to 19 you can say. So 7 days, so it is less than a lakh per day average, or say 1 lakh per day. Well, no comments on this till now. I'm just going back to other records. This is here, you can say. This is today's record, yesterday's record, which is 18.86 crores people have been tested, and that is 14.505 percentages. While, as usual, those who have not been tested, it stands 85.5%. Only 77,64,000 were tested yesterday, which is of course a little higher than the previous day, but still dropped down. It's 48% down. And there is a total cases so far 1.06 crores, which is used, means they are maintaining that these are total cases because they are not testing. Because testing percentage is also not increasing, so this is not increasing, simple. And only yesterday 13,823 people were declared positive, and this is 152,718, 1,52,718, 1,52,718 people have been declared dead so far. Now, what actually it is? 1.81% people who were tested were declared positive. 1.42% is previous day, and 2.52 last but previous day. And then fourth day back is 0.94, and it's little down, that's 1.92 in last 4 days. So it is 2.5 crores, you can say, per day, and still it stands high. And latest information is that we have to wait for 11-26 days for purpose of testing, but I think now they will not worry about tests because they think they have to expedite vaccination. Let us see what happens. Even if vaccinations are done 1.42 crores per day, that should be okay, but they're not going to do that, I know. But still, it's very low, very low still, 6.74 lakhs since 13th of, I should say, let us write here for reference, 13 somewhere, and I can't write here, where I think if I write here, it will encroach this area. So let us say something here we can write. Let us just for information that it is in our record, we can say 30. You will say let's a little give it back. 13 January. We can say 13 January. We can write here start. We can say start here. Start of vaccination. So you can say today is record of 19, so 7 days. So we can say per day it comes. If you take 7 days here, we can say per day average it comes as 96,405, which is per day. Start, and this is per day. 95 this, so this is a start here. And you can say here, we can just divide it like this, so we understand what we say. So it means we don't have right to say something against this because still it's a start. But we have to speak about others. 326 days, only so many percentages. This is clearly indicating that there is no will on government for testing people. भारत सरकार की कोई इच्छा नहीं लगती है कि उन्होंने देश की पब्लिक का टेस्ट करना है कोविड-19 का, ऐसा नहीं लगता. और समाचार मिल रहे हैं, वी आर गेटिंग न्यूज दैट स्ट्रेन और वेरिएंट हैज स्प्रेड इसका भारीपन जो स्ट्रेन है बहुत तेज चलने वाला स्ट्रेन या वेरिएंट वो 60 देशों में एंटर हो चुका है और हम भी उसमें शामिल हैं। ये एक बहुत बड़ी बात हो गई है क्योंकि हमारे अभी भी 111 करोड़ लोग पिछले टेस्ट नहीं करा सके हैं। उनका क्या होगा शायद वो नहीं जानते और हम उनको बताएं भी तो वो समझेंगे नहीं। और अब तक 9 करोड़ और 35 करोड़ का ही रेशियो जो अभी तक है वैसा ही कि वैसा है। आई एम नॉट फाइंडिंग एनी इंटरेस्ट that is the status. These graphs are telling other story. Well, let us see what happens. I cannot criticize all time. That's not my job. Now, let me say what posting says that I posted, my report says, which I worked on, and as usual, I'm reading from my word page, but it's already available on text, videos, all information. If you wish, you can read there, or you can listen to what I'm saying. I'm saying in very short, and it says that about report of yesterday, which we have published today. I have published on my Facebook page, and government has published on its website data only, which is covered in these five columns. These 5 columns are government data, as you know. This 1, 2, 3, 4, 5 yellow highlighted columns. This is government data based on which we have worked out every detail here. And this data, which is vaccination data, is also taken from same website and put in here. So let us go and see what actually is. Now title is there, I don't want to repeat that. And again I said, don't be misled by vaccines. Vaccine has different function. It's not going to stop, it's not going to treat your fate, always just give some immunity to you. आपकी थोड़ी सहायता करेगा, इसलिए इसको इतना ऊंचा मत ले लेना। और बहुत से देशों से रिपोर्ट भी आ रही है कि उससे प्रॉब्लम भी हो रही है। Well, no, I'm not going to I want to not say no to that. It's precautionary measure. If you get it, it's fine. As far as it saves you from some impact, I think then it's no problem. After all, it is medicine. And then you can say COVID-19 strain variant 102 cases in our country, and I think this is 2 or 3 days back report. I don't know what's current status. It's not available on the website. This virus has already spread to 60 countries. This is confirmed from news. And inoculation vaccines inoculated only 6,74,835. 6,77,735 लोगों को अभी तक इंजेक्शन लगा, वैक्सीन लगा। 19/1/21 तक, 19 January 21 तक। Now what is schedule? Nothing is given about schedule. 1.45 crore vaccinations and inoculations are required per day. 1.45 crores vaccination and inoculations are required per day to provide immunity to people of this nation, this country. In 91 days, I'm taking 91 days period, it can be more. However more you can say, you can't keep more than 6 months. So even if it's 6 months, means 70 lakhs are required per day. We have failed in testing a population at all levels because 86% people have not been brought to test in more than 326 days. That is very much surprising and discouraging. And it is telling us that we are not serious. All these citizens belong to poor and lower middle classes. Ministry publishes only 85% fake results. They don't give correct analysis. Actually, they don't do any analysis. Now, how can ministry claim that COVID-19 has been brought under control just at testing of 14.5% people, which is nowhere consistent but ridiculous statement? Whole world must laugh at our performance of testing with current speed at it shall take more than 3 years for accomplishing whole testing. If they have intention so to do, otherwise nobody will be tested. Same way, it may apply to inoculation of immunity providing vaccines if no schedule is prepared for its implementation. It's also alert that Norway has reported many deaths, 25 more, and they warned whole world, be careful, for particularly inoculating those old people who may have no body-like structure so that it can resist vaccination. Means their body may not permit this. All studies must be made prior to resorting to abusive and negligent act, so that undue hardships, losses may not be allowed to all those who are prone to such bad incidents. Now, what government claims, as usual, I quote, it's nothing new, same language. Government of India is taking all necessary steps to ensure that we are prepared well to face challenge and that threat posed by growing pandemic of COVID-19 coronavirus. With active support of people of India, we have been able to contain the spread of virus in our country. Most important factor in preventing spread of virus locally is to empower citizens with right information and taking precautions as per advisories being issued by Ministry of Health and Family Welfare, unquote. Now, our contention is what it says. Conclusive facts are vaccinations has started, but only 674,835 people or 6,40,835 till yesterday, 19 January 2021, they were inoculated. And we have to ensure safe system, safety, test self, treat self, vaccinate self, isolate self, oxygen self, ventilator self. Do not do all activities yourself on your own without depending on government. Self means on patient's expenses. Give government whole credit and you may spend money. Credit of those discharged, credit of all controls, you give to government and you spend your money and your efforts. Government is just waiting for your information that so many people have been effort. They will not do anything, they'll just give information and that's what we have done it. Well, keep ready many lakh rupees for expenses or suffer forever. Because one may also be infected with a strain or variant because it is available now in 60 countries. It has been working there and it will propagate. It will thrive very fast. Take your care for post-discharge from hospital or from isolation room on your own expenses. Then they are posting URLs of about 46 messages and videos, URLs about 59 today will be 60th. Now come on to COVID-19 strain variant report update on 20 January 2021. Forenoon, Bharat public must think very seriously about how to achieve risk or loss prevention by application of required pertinent measures in relation to COVID-19 plus explosion. Because nothing is being seriously done by our nation, there is no loss prevention method. Incoming vaccines that are being done, inoculated, shall not impart any recovery, treatment, solution, or regular protection, but only immunity augmenting tool or augmenting, you can say, augmenter. Building or other articles that always remain prone to fire, but if loss preventing techniques are applied, methods are applied, expected loss to life and expected loss to property can be minimized. So this also applies to COVID-19 plus and you can say strain and variant which are very fast, rapidly they move. Possible magnitude of risk must be understood or evaluated by analyzing its power. And then based on that analysis, practical applicable solutions must be searched out and finalized prior to it is too late. Now, COVID strain variant, you can say, has already spread to 60 countries, including Bharat, Brazil, Canada, and all others. All names can't be taken. UK PM ignored advices by experts and they have been suffering now. 20% of public is prone to virus infection and 33 public are as such, they are so strong that they are not, you can say, showing any symptoms, but they can infect others. And already about 100,000 people lost their life. And there is information today from USA that 400,000 have lost their lives and more than 2 crores have been infected. More than 2 crores. I say around 2.5 crores have been infected and about 400,000 people have lost their lives. So this is big loss to the world. If America-like country cannot control it, means 400,000 have gone from there. Individual out of 130 crores in our country, only 18.86 crores, or only you can say 14.505% people have been tested in 326 days, and 85.459% population not tested yet. Now, no worry for even COVID-19 is still plus on government. The government is not at all having any concern of that. They think if the vaccine, if they inoculate people, I think people will keep silent and the problem will solve, which is wrong conception. People of us have become sheer careless, irresponsible and ignorant, whereas this problem has been rising every day since March 1st, 2020. No plan is available for remaining 86% or approximately 85.495% population. There is no plan at all, who have been remaining untested till now, which has made it impossible to fix certain required milestones and schedule out prospective timescales based plan to combat COVID-19 plus impacts. It seems that in false contemplation of vaccines provisions, government has neglected necessary ground organization of initial testing to detect patients and provide them with mandatory treatment, and it is a flop on part of government, I can say, as well as a flop on part of people of this country. It's a must to have a concrete schedule of plan to control COVID-19 plus, just avoids powerful explosion that could cost crores lives directly and many crores additionally infected, and also to give post-discharge care, which may be required 6 months later. Many discharged patients have reported back reinfection around the world, which included post-discharge care, but this aspect has been condoned by government, by our government. You can say it has been observed that more than 66% of those who were discharged after formal treatment did not recontract symptoms of COVID-19 in one way or other. It has been observed that more than 56% of those discharged after formal treatment did recontract symptoms of COVID-19 in one way or other. Testing speed has been very, very slow, which is non-conducive category, you can say. I can't say that they are testing, in fact, is so slow, extremely unsatisfactory. That means no plan can be charted out at present. The state and government is not interested in declaring any plan. Now, requirement of testing plan, inoculation plans, treatment plans and post-discharge care plans are not available, which must be effected professionally, but unfortunately we don't have, which missing details clearly indicate that we are a sleeping, inefficient nation. Real state of future of COVID-19 in Bharat, India cannot be correctly either forecast or predicted analytically in absence of such plans or schedules. Every day government is giving fake news. Papers are giving fake news that we are lowest in cases, but fact is that we are not lowest in cases. If you say you are declaring something based on only for 14% cases you have done, this is not effective, this is not correct. In this connection, I sent mails to government many days back, or you can say many weeks back, but there is no response from government, and I first time think that there is no one to read anything or see any mail or any. I put video URLs also, but there is no one to care in government. It's regretful, really. I don't want to talk on this. No change or accelerating program is available or visible. No projection of any program is available. In fact, testing speed has been still really outstandingly unsatisfactory, whereas government has always tried to reflect least number of positive cases, and that is by manipulation. It's called self-devised fraud. No report indications seem to be on part of government to an extent testing a whole population is concerned. And in case of no right reliable data, no projections can be reflected. Government doesn't take any responsibility for testing of common citizens. It's assumed to be responsibility of citizens itself to have a test if one feels that it's affected, symptomized by COVID-19. Government has distanced itself from owning public health responsibility. Total tests conducted up to 19 January 2021 is 18.86 crores. Tests conducted on 19 January alone is 7,64,000 only, which is too low. I think it's a quite drop in testing, and it will go further down. I think they will not they will not augment, but they will drop further intentionally, I think so. Or they don't care. Nobody is there to check what's happening. Total corona infections till 19 January 21 is equal to 1.06 crores, approximately, little less than that. Positive infected cases declared on 19 January 2021 equal to 13,083. This is where the dense 13,812, and they will jump. See, we are down, but facts start speaking something else. Death update till yesterday, 19 January 2021, 152,718. 1 lakh bound है 718, 1,52,718. and population tested till yesterday is 14.505% only, and that is since March 9, 2020. Remaining population staying without test 85.495%, and time required to test 13, 17 and 11, 26 days respectively for whole population of remaining population. So 13, 17 or you can say 11, 26 required number of days. Do you accept them? It's up to you. It's too long period and people actually cannot wait for so much. But there is no one to speak from people of this country, and people are silent, and you can say maybe they are scared of government. Why is government not improving its bad performance? I cannot answer. No one can. The government has not answered yet. They will not respond. Even political parties are not taking an issue in this, and public are not talking. Government doesn't intend to speak anything in this regard. Government thinks that maintaining silence is better than something else. Government has actually ignored poor people, lower class people, society members all way. Why is government sleeping? No response from me or you. You have to respond because you are too sleeping. You too are sleeping and you don't want to answer this. So you are not serious, and so if there's a bomb, certainly it shall explode in terms of COVID-19 bomb. Government doesn't look anxious to test all citizens. That is true. It's understandable. Testing is too slow. Government has had no responsibility to citizens of this country, particularly those who expect to don't have money. Why should people of Bharat, India suffer for none of their fault? Only sufferers are poor sections of society and not upper middle class or rich. Shall we allow such unbecoming state of lack of public COVID-19 testing? Why are sufficient people not raising their voices? Have people become voiceless? I think they are voiceless under Modi's design. They cannot speak. They have become virtual slaves. Why is government left its responsibility to people on their own care? Everybody cannot afford. All walks of life cannot afford. What for funds they received for this? Where the funds are gone? They will also charge for injections or for vaccines. They will not give free. Only medical front workers are allowed for free. It seems that people shall not be tested because till now no such policy does exist. And there is no policy, and there will be no policy at all. It's completely clear. There is no policy at all. Do yourself what you want. It's your responsibility, full responsibility. Testing, treatment, isolation, vaccination, post-discharge, whatever you have to face on your own. I don't want to repeat what expenses you have to do every day. I speak, and it's already posted. You can go and see there. So it is your problem, your headache, though you do not bring this disease to this country, but you have to face all these expenses on medicines, injections, oxygen, ventilator, PPEs, etc., whatever medicines you have. And complete expenses, not simply that you stay. Isolation is very expensive, and employing medical attendant is very expensive. Testing fee is very expensive, and you have to take good food also. That's very expensive. So you can say you are in doldrum, you are in different and difficult state. The nation is not thinking for you. You are thinking for yourself only if you can. And if you don't think for yourself, this is your problem. This is not government problem. Government is lethargic. People are lethargic, and something will happen at that time, 11th hour, and you will not be able to do anything. So only way is forget political guards and test yourself, treat yourself, vaccine yourself, isolate yourself, vaccine yourself, ventilator yourself. Self means only patient's expense. And only give credit to government because they are not doing anything. When government does not do anything, you have to give them credit. All right, keep ready many lakhs rupees all time, and that is where you are supposed to do. And this is beauty of this game, that there are people like this government who don't care, and what all these stay in this resource you can say augmentation, which is not going to happen. It has not happened till today when it is 123rd entry. So you can say about 4 months have gone. I have been talking every day. I have not found anything extraordinary from government declarations. Government is just making jokes of this state of COVID, and it is moving with very rapid question of life and death. What I can say, sleeping government, sleeping people, non-serious government, non-serious people. Nobody cares for what happens in tomorrow, what shall happen tomorrow. And government is just making news that we are vaccinating, and they think by making this news, these people shall forget COVID-19, but that's not going to happen. It's really very tragic that we people have been brought to such a state which should not have happened, but it is happening. So this pro forma gives information to you, which you must understand and use. जिम्मेदारी तेरे को नहीं कह रहा मैं, I'm just trying to give you input of this. मैं आपको बता रहा हूँ क्या होना चाहिए, क्या नहीं होना चाहिए. कभी कभी बोलते बोलते भी खुश्क हो जाता है गला, हालांकि सर्दी है, ऐसा होना नहीं चाहिए. संभालना है संभाल लो, नहीं संभालना तो वैक्सीनेशन गाने गा लो. यही होता है. जब आदमी थक जाता है, पहले थक जाते थे तो पिक्चर चले जाते थे, चलो तो रेस्ट करके आते, 3 घंटे 2 घंटे फ्रेश हो जाएंगे. तो वही चीज़ है. अब आप वैक्सीनेशन की पिक्चर देखिए और खुश होते रहिए. ये पिक्चर चल रही है, स्ट्रेन की पिक्चर चल रही है, वेरिएंट की पिक्चर चल रही है, और कोविड-19 तो बहुत पीछे चली गई है. भाई आप 85-90 करोड़ जो लोग हो, मेरे ख्याल 85-86% अगर आप 130 का निकालें तो 100 करोड़ से ऊपर जाता है. तो देश के जो ये 100 करोड़ लोग हो, आप भार हो देश पे, ये तो लगता है. अगर भार नहीं होता तो सरकार आपके बारे में सोचती. सच बोलना चाहिए ना. तो सच तो यही है कि आप सरकार पे बाहर हो, बहुत बड़ा बाहर. सरकार आपका टेस्ट तक नहीं करा सकती, कहने की बात है, लेकिन सच भी है कि सरकार आपका टेस्ट तक नहीं करा सकती. और वैक्सीन के पैसे भी आपको देने पड़ेंगे. हालांकि अभी तो वैक्सीन बने भी नहीं होंगे इतने कि सबको लग जाएं. उन्होंने अभी तक 6 लाख कुछ लगाए हैं, और देखो न्यूज़ आ रही है कि कितना बड़ा काम कर दिया, जबकि एक दिन में 1 करोड़ 42 लाख लगने चाहिए थे. खैर अभी हम बहुत दूर हैं इससे, और मुझे लगता नहीं कि वो होगा. ऐसे ही हवा मारेंगे और आप हवा में इनकी आएंगे. ये भारत देश है, भावनाओं का देश. भावनाएं आपकी उठा दें, जला दें, आग लगा दें आपकी भावना में, और आप खुश होते रहेंगे, देखो कितना बढ़िया काम हो गया. शायद सरकार भी इस बात को समझती है कि आप लोग भावना में बहने वाले हैं, आपको ज़मीन से कोई मतलब नहीं है, हवा में उड़ गए भावना में और काम हो गया. और सरकार की वाहवाही, देखो वैक्सीनेशन लग रहे हैं, अब आने शुरू हो गए हैं फेसबुक पे, बड़ी देखिए करोड़ों लोगों को वैक्सीनेशन लगेंगे. एक को भी वैक्सीनेशन का मतलब नहीं पता है, वो जानते भी नहीं इसका मतलब क्या है, लेकिन खुश हो रहे हैं. मैं साफ साफ बता देता हूँ, ये वैक्सीन जो लग रहा है ये इलाज नहीं है. ये आपको सिर्फ थोड़ी शक्ति देने के लिए है कि आप कोविड को थोड़ा दूर कर दें कुछ दिनों के लिए, क्योंकि इलाज के बाद भी तो ये वापस आ रहा है. जो 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 गोलियां खा गए, आइसोलेशन में रह गए, कई आधे से ज़्यादा लोगों को ये वापस आ रहा है 6 महीने बाद. तो ये जो वैक्सीनेशन चल रहा है ये आपकी सिर्फ शक्ति बढ़ाएगा. और खुश मत होइए, ये फ्री में नहीं लगेगा आपको. ये आपको फ्री में नहीं लगेगा, पैसे देने होंगे, और 1 के नहीं 2 के 3 के भी देने पड़ सकते हैं. और कभी आपको सूट करेगा, कभी नहीं करेगा, मैं नहीं जानता. मैं डॉक्टर नहीं हूँ, ना मैं साइंटिस्ट हूँ, क्योंकि खबरें बहुत कंट्रीज से आ रही हैं, जबकि कई कंट्रीज़ में तो कुछ लोग मर गए. जैसे नॉर्वे, रशिया क्लेम करता है मेरा वैक्सीन बेस्ट है. उधर कुछ लोग घबरा भी रहे हैं कि सब ठीक नहीं है. अब इसका मैं उत्तर नहीं दे सकता, आपको इंतज़ार करना पड़ेगा, प्रतीक्षा करनी पड़ेगी, कहिए आप. लेकिन जो भी है हालात, हम खुश तो हो सकते हैं कह के, और गवर्नमेंट भी सोच सकती है कि अब टेस्ट कराने की ज़रूरत नहीं, हो सकता है जो टेस्ट सभी कोविड के चल रहे हों और भी कम हो जाएं, क्योंकि वो कहेंगे अब इंजेक्शन तो लगेगा ही, टेस्ट की क्या ज़रूरत है, क्योंकि कॉमन लोग ऐसे ही होते हैं, वो सोचेंगे नहीं कि ये क्या है, तो इलाज तो हो रहा है ना आपका, आपको इंजेक्शन लग जाएगा, महीने 2 महीने में बातें ऐसी होंगी, 1 महीने में, 1.5 महीने में, 15 दिन में आपको इंजेक्शन लग जाएगा। ये एक ऐसा ऐसा सलाब है जो पब्लिक को घुमाने में अच्छा है। ऐसा था ना व्हर्लपूल जिसको बोलते हैं, जब पानी दोनों तीनों तरफ से आता है तो ऐसे घूमता है कि समझ नहीं आता है किधर को जा रहा है। तो सरकार ने आज हमारे देश की वही स्थिति बना दी है, व्हर्लपूल बना दिया है हमको। एक पानी घूमता हुआ रिपल जैसे बोल सकते हैं, ऐसे 3-4 डायरेक्शन से पानी आए और एक जगह घूमने लगे। हमारे देश की स्थिति आज वो हो चुकी है, समझने को हम कुछ नहीं समझ पा रहे हैं, तड़ी भी हम मार रहे हैं कि हमें कुछ नहीं होगा, बहुत सी बातें हैं। खैर, आपकी मर्जी है, हालत मैंने आपको बता दिए हैं और ग्राफ मैंने आपको दिखा दिए हैं और बता दिया है कि क्या हाल है देश का, आपके सामने है। और अब मैं इससे ज़्यादा क्या बताऊं, हर रोज़ की बात है। अभी तक मैं कह सकता हूं कुछ भी सही बताएं तो सही नहीं है, सब कुछ अंधकार में है और अंधकार में ही रहेगा, क्योंकि अभी बहुत लंबा सफ़र है और तब तक कितने लोगों को कोविड हो जाएगा शायद वो भी नहीं जानेंगे। लगना, बुराई का, प्रॉब्लम का ना पता लगना और शरीर को लग जाना बहुत बड़ी बात है। और जब अगर आपको पता भी लगा और उस टाइम बहुत देर भी हो गई तो आप कुछ नहीं कर पाएंगे। बस इतना ही कह सकते हैं कि अपने को अगर आप कर सकते हैं तो टेस्ट तो कम से कम करा लीजिए, ये तो पता लग जाए अभी तक आप सेफ हैं या नहीं हैं, क्योंकि ज़रूरी नहीं है कि आप कुछ ही दिनों में उसका इफेक्ट दिखाई दे, काफ़ी समय बाद भी इफेक्ट दिखाई दे सकता है। आपको काफ़ी समय बाद भी पता लग सकता है कि मुझको ये था, लेकिन उस समय आपका इलाज नहीं हो पाएगा। और शायद जब ये स्ट्रेन भी आ गया है, वेरिएंट भी आ गया है, तो ये वैक्सीनेशन भी शायद इफेक्ट ना कर पाएँ। मैं इतना कह सकता हूँ, कोई ज़रूरी नहीं है कि इफेक्ट हो, ये तो खैर एक्सपर्ट ही बता सकते हैं इसका इफेक्ट होगा, वो भी शायद एक्सपर्ट अब नाम के रह गए, क्योंकि जब हमें यही नहीं पता बीमारी क्या है तो क्या कहें। बड़ी बड़ी कंट्रियाँ डर चुकी हैं, जब 60 देशों में आ गया तो बाकी जो कुछ ही हफ्तों में, देखिए कुछ ही हफ्तों में, अभी शायद कुछ हफ्ते भी नहीं हुए हैं, 60 देशों में प्रवेश कर गया। तो 180 देश में या 200 देशों में जाने में कितना टाइम लगेगा? 60 देश से 120 देश होते हुए 1 हफ्ता लगेगा और 120 से पूरे विश्व में होते हुए 2 हफ्ते लगेंगे। इसलिए ये खुशी लहर जो जो वैक्सीनेशन की चल रही है, इतना खुश होने की आवश्यकता नहीं है। आप खुश हो सकते हैं गलत फहमी में जीने के लिए, तो ठीक है, आप गलत फहमी में जीते रहिए और सोचते रहिए कि वैक्सीन आपके पास आ जाएगा और आप मस्त हो जाएंगे, लेकिन ऐसा होने वाला नहीं है। इसीलिए टेस्ट तो आप चाहे सरकारी अस्पताल में जाके कराएं, कहीं भी करा तो लीजिए, कम से कम रात की नींद तो सही रहे कि हाँ हमें कुछ नहीं अभी हुआ है और आगे हम अपने को संभालेंगे। और अगर हुआ है तो भाई फिर आपको संभालना तो पड़ेगा, उसे कौन मना कर सकता है। अभी हालत बुरी तो है, ये मानते हैं बहुत बुरी भी है, लेकिन अगर आप चाहें अपने आप को संभाल लीजिए। और आपको प्रॉब्लम इसलिए भी होगी कि आपके पास इतना फंड नहीं होगा जितना चाहिए। जो पैसे वाले हैं, अपर मिडिल क्लास के हैं, इंडस्ट्रीज़ हैं, रिचेस हैं, उनकी तो मैं कुछ नहीं कहूँगा कि वो तो शायद टेस्ट भी करा चुके होंगे अब तक, अपने आइसोलेशन के इलाज भी करा चुके। मैं कुछ लोगों को जानता भी हूँ, 7 मेंबर्स को हुआ फैमिली में, और वो पैसे वाले लोग हैं, बड़े बड़े लोग हैं, गाड़ियों में चलते हैं, एसी में रहते हैं, कभी बिना गाड़ी से उतरते नहीं है, पैर नीचे नहीं रखते हैं, हवाई जहाज में चलते हैं, वर्ल्ड टूर करते थे, तो उनको हो गया होगा किसी कारण से। लेकिन मैं ये नहीं कहता कि आपको हो गया होगा, मैं ये बिल्कुल नहीं कह सकता हूँ, क्योंकि मैं लॉजिकल आदमी हूँ, मैं रीज़न में बिलीव करता हूँ और कारण तो होना चाहिए ना। अगर आपको टेस्ट नहीं कराया, हो सकता है आपकी बॉडी अच्छी हो, आपको ना लगे, लेकिन आपके अंदर हो सकता है प्रभाव हो, वो दूसरे को लगा सकता है। इसलिए ये बात को एक्सप्लेन कितना करूं, थक गया मैं कर करके, और कोई कितना करेगा एक्सप्लेन। एक ही बात को रोज रोज करने का मतलब पागलपन भी हो जाता है, क्या बार एक ही बात को रोज लेके बैठ जाता है, बोलेंगे लोग। लेकिन जब तक ये रिकॉर्ड चल रहे हैं, जब तक ये स्टैटिस्टिक्स आ रहे हैं, डाटा आ तो पड़ता है ना, कुछ नहीं कर रहा कोई भी, बस बातें 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 ही हो रही हैं। और ये सोच के कई बार आग बबूला हो जाता है दिमाग कि आखिर ऐसा क्यों हमारे साथ ही ऐसा होता है, ऐसा क्यों हो रहा है हमारे साथ, क्या हमें क्या हो गया है हम। इसलिए फेस किया है, मेरे परिवार ने, मेरी बहन ने और रिश्तेदारों ने फेस किया है कोविड-19 को, वो किस तरह किया हम ही जानते हैं। हालांकि हालत बिगड़ी नहीं, बच गए, लेकिन पैसा तो लगता है ना, दुख होता है कि हमारी किस गलती की वजह से पैसा लग गया। अब आज की बात में ज़्यादा लंबा क्या करूं, मैंने जो डिटेल देनी थी दे दी। अब आप समझ